Recently, I made a post about the kidnapping question. How would other people react if we gave them your life? And I made the point that often it seems that the negative feeling people have about their lives isn't really so unusual. Other people might feel it too. In fact, sometimes it's tempting to say that the person's reaction is really quite normal and expectable. When I'm talking to mental health professionals, I'll often say, do you ever see somebody who's depressed and then you ask them about their life, and by the end of it you think, wow, if that was my life, I'd feel the same way. Or, I don't think I'd be doing even as well as them. And almost everybody nods. We're supposed to be the big helpers, but if we were in the same boat, we think we'd be in the same boat. So it's tempting to say that with at least some clients, we're tempted to diagnose them as being completely normal. And often I think that's true. It's the life that needs to change, not the person. But still, they are experiencing symptoms of depression, and often enough of them that they meet diagnostic criteria for major depressive disorder. So do they have a disorder or not? Well, there is a way out of this. Let's say somebody goes to see their physician with a broken femur, and they say what happened. They were skiing, and they lost control, and they hit a tree. And we might think, well, anyone who had the same accident would also have a broken femur. So their problem is really quite normal. But does that mean that they don't have a broken femur? No, they have a disorder, if you like, but we know what caused it. Someone comes to see us with a rash, and we figure out it's chickenpox. And we ask about that, and it turns out that all the kids have got chickenpox, and nobody's been vaccinated. Mystery solved. We know why they have chickenpox, but it's still a disorder, and they still have it. So depression doesn't have to be a complete mystery in order to truly be depression. It's still depression. We just know why it's there, which is good, because that gives us a clue what to do about it. This is one reason why I like psychotherapy as an approach for most cases of depression, and why the British medical system has referred to psychotherapy as a frontline treatment for depression, unlike medication. We're working with the person to change the circumstances that make a depressed state normal and expectable. I've seen a great many people benefit from antidepressant medication, but I've also seen many people who get very little from that approach. And I think that if we have a person in a situation or a way of living that expectably and predictably brings on many of the symptoms that we call depression, and then we give them a medication to change that very expectable result, in some cases, we're not trying to bring about normality. Their response is already normal. We're trying to bring about a less expected, less predictable response. We're trying to have them in a depressogenic situation, a situation that normally predisposes a person to depression, and have them not be depressed. In a sense, we're trying to bring about an abnormal response, not a normal one. And that seems to be more difficult. Now, please do not take from that notion that I oppose all medication for depression. I don't. Again, I've seen some very nice responses to medication. And remember that this vlog is not any sort of psychotherapy. For that, you have to see and evaluate a person live and in person. This isn't a rationale to start medication, or stop medication, or change medication for anyone. But I do advocate, in most cases, looking at the circumstances surrounding a person's mood problem. And if those circumstances seem to be contributing, then at least part of our work should be focused there. You can get How to Be Miserable from your local bookseller or from Amazon. The link's below.